Welcome to the How Do I Become podcast. My name is Chris Gouveia. I'll be your host. With this being our first episode, I wanted to give a brief introduction of what the podcast is about. At its core, this will be a podcast exploring different career paths. Every week, I'll be inviting a guest on from a chosen profession to give us real-world insights into what their profession is like. The How Do I Become aspect will explore the path individuals took on their journey, but we'll also hear about lifestyle factors, things they enjoy about their job, things they don't enjoy. The overall goal is to try and give listeners a realistic idea of, one, how to end up in that career, and two, what is that career really like? With that, thank you again for listening. This will be our first episode. How do I become a doctor? All right, so we're recording now with Derick Paul, a fourth-year medical student from the University of California, San Francisco. Derick, thanks so much for joining us.
Thanks for having me, Chris. It's really great to be with you. I'm honored to be one of your first guests here.
Oh, the pleasure is mine, the honor is mine. Full disclosure for the listeners, I am a physician in my day job myself, but when I thought about who I wanted to hear about the path to becoming a doctor and what it's like going through that training, I wanted someone who wasn't 10 years out from that process. So Derick was really at the top of my list. So I'm really, really excited to have him on. Derick is a fourth-year medical student. So fourth year is the final year of medical school.
That's
I'm
right.
excited to hear about future plans, and we'll discuss that for sure. But take me back. What led you to pursue medicine?
When I was in high school, I had zero interest in becoming a doctor. Zero interest. I actually wanted to be a composer and a conductor.
Oh,
Um,
wow.
and believe it or not, when it was time to apply to colleges, I actually my top choices were music conservatories, and really what happened is I didn't get into the programs that I'd like to, and you know the long story short is that by the end of college I had added on a biology major, so I ended up staying an extra year. I did a dual degree, and by the end I had decided that I was gonna try to go to medical school, but it definitely wasn't my intention going in.
Yeah.
What actually changed my mind was I was an EMT
Wow.
in
Okay.
and I think that was ended up being the turning point for me.
Yeah. I mean, I think I was similar to you. I knew I didn't want to do medicine when I entered college. My aunt was a nurse practitioner and had kind of told me about a lot of the problems in medicine and circuitous life circumstances. I saw a flyer one day for a scribe program where you could volunteer in the emergency department.
Wow.
And I met a great mentor, and I saw medicine firsthand. And it was one of those experiences of there is a very unique power that I think medicine serves in patients' lives and in communities and society at large. So I mean, that was kind of a very powerful. That was my powerful personal experience. So tell me a little bit about what happened as an EMT, or during your biology training, or kind of what flipped that switch for you. I guess that said, for my career path, maybe this is the right route for me.
Sure. And it was very similar to your story there, which is they kind of needed to see the um, the beauty and the power of the role that medicine plays in people's lives myself with
Hmm.
my own eyes before I could
Sure.
come there. Um, I was an EMT, like I said, in Prince George's County, right outside of Washington D.C. Um,
Mm-hmm.
there was a couple of things about walking into that one of the most important days in someone's life, over and over, and
Hmm.
realizing that at these inflection points you could have a lot of impact, and understanding that literally the best thing I could do as an EMT was to get this patient to those folks. That was the best intervention. You learn a lot of things, but really the intervention was get them
Hmm.
to a
Hmm.
doctor. You need to get this person to a doctor, and I saw that and I started to think, well, maybe that's what I could see myself doing. And a piece of it too is I didn't have the words to describe this at the time. I think now we'll call it like the social determinants of health. Now I would call
Hmm.
it, structural racism. But
Hmm.
I was seeing stuff that I knew wouldn't happen in the suburbs, that I knew
Yep.
wouldn't happen in more affluent neighborhoods. And I couldn't quite put my finger on it, but once you see that, once you see people
Mm-hmm.
suffering because they have less economically than others, you can't unsee it. And
Mm-hmm.
so by the time I was coming towards the end of college, I felt like I really had a responsibility to, with the whatever consciousness I had, whatever ability that I had, to try to work on some of these issues, to try to make life better for people. And so that kind of put me on the road towards medical.
I think you word it very well, which is there are certain things you can't unsee once you've kind of lifted the veil and you've gone deep enough into pursuing medicine. And for some people, it's a turn away. They don't want to pursue it because it
Sure.
brings out something in them that doesn't make them comfortable. That's totally reasonable. But for many people, I think it is a calling, and I think that's important to acknowledge as people go down this path. I think you also hit on something else that is important for this podcast in particular. We're talking about how do I become, the past, both typical and atypical. So I was a fairly typical applicant. I finished my college studies, I applied to medical school, and then went right through. But I think you're hitting on something that's really important, which is there are many, many routes to get to medicine. So maybe if you could expand on that. I think there are a couple different routes that people take. I mean, there's very non-traditional students that pursue medical school now.
So I didn't apply directly in, like a lot of folks that I knew. By the time I decided to apply to medical school, I went to one of the counselors, and everybody's got one of these stories. But I remember the counselor saying, like, you should really think about doing something else. Um, um, and I was like, no, this is it. I want to do this. So I ended up doing a post bac. I did a research year after
Mm-hmm.
my post bac, applying to medical schools. And any pre medical student that comes to me and they're like, I don't know if I can apply to medical school, I always say, of course you can. It's a matter of how much
Mm-hmm.
time and you're willing to put into it. Because if you're willing to put in
Yeah.
a couple extra years, which unfortunately sometimes that is what it takes, depending on where your starting
Yeah.
point is, you can absolutely do it. So many of my classmates here at UCSF, I think UC Berkeley feeds UCSF really heavily, and then the next ones
Yep.
are like Harvard and Yale. And I didn't apply
Mm-hmm.
to those schools; it wasn't even on my radar um, to do that. So I think a piece of it is, but like once there's like for me, I mean, at least there was a click where I was like, oh, like I'm just as good as anybody else. I'm just as smart as
Right.
anybody
Right.
else.
Mm-hmm.
Maybe my starting point on this thing or that thing is a little bit behind, but let me work harder. Let
Mm-hmm.
me get up earlier. Let me stay later. Let me put more effort in. And you stop thinking that there are some people that are smarter than me. There are some people that are better than me. And if
Sure.
you free yourself of that, and all of a sudden,
Mm-hmm.
you know, this sky's the limit for you.
I do think it's important, and I think it's a minor point of this podcast, but one of my underlying passions was to bring information to people that otherwise wouldn't be getting it. I think you and I probably have a similar or a commonality in that we didn't have physician parents or we weren't surrounded by physicians, and that can really make a difference about your interest or your willingness to pursue a career. And so, if I can create a podcast series that touches on this with doctors and other careers that maybe people from those communities don't have familiarity with, and that can instill a certain amount of passion. I think that's a huge win, and that would be a huge goal for me for this podcast moving forward. So um, let's move on a little bit. So tell me a little bit about what medical school is like. I think that's something that people are interested in. Tell me what it's like being a medical student all through these 4 years.
Yeah, so I think the traditional medical school pathway is first and second year are your preclinical years where you're in the classroom, um, kind of like undergrad, but now you're really focused on the classes that are relevant to medicine. And then third year is your first clinical year where you go through and do all the major rotations. And then fourth year you sort of do some more rotations that are specific to what your specialty is. Now that system, I think, is getting broken down a little bit and getting
Hmm.
shifted. So
Sure.
you know for me, our curriculum, it's really the first year and a half that's preclinical. um, and then they send you off to clinical rotations so that you get that experience earlier. And what we did is we do, instead of doing discrete classes where you have I've got my biochem class and I've got my anatomy class, or
Hmm.
we do um, basically systems that, they used to be kind of like organ systems where they're like, you're in your neuro, or you're in the brain or the heart or something like that, and you'd go through that for a month. Now
Hmm.
they're even broader categories where you do
Hmm.
brain movement and behavior, and that includes both neurology
Hmm.
and psychiatry. We'll do life stages, which includes
Hmm.
pediatrics and
I
most of
see.
the OBGYN content, right?
Hmm.
And everything's weaved throughout. So instead of just doing all of gross anatomy in the
Yeah.
beginning, you'll have anatomy labs that are specific to that system that you're doing. And so I think this is nationwide. At UCSF, they call it the Bridges curriculum, um, to try to have a more holistic, comprehensive education that is less, it's less segmented, and more
Hmm.
integrated. I guess integrated is the right word. It's more integrated
Hmm.
curriculum. And then when we get to third year, it's very traditional. It's very much the way it's been for the last, I don't know, 100 years or so, where you've got your core rotations. You've got pediatrics and surgery and internal medicine and psychiatry, and the rest of them, and you go through each of those, and those are either they're going to be anywhere from 4 weeks to 8 weeks long. So you're doing different specialties, and you're immersed in the different specialties for a month or two
Yeah.
at different places. I think it's for me, it's
Hmm.
one of the hardest years of my life. Um, they say
Sure.
that there's some ranking of like the hardest life events, and like one of them is like getting a new job, right?
Hmm. Sure. Yeah.
30 years you just getting a new job at a new place every month is very difficult.
Yeah, I mean, I think you definitely confront many of those challenges when you're on the wards, that third year that you're, like you're saying, going to a variety of different settings that are quite different from one another. The VA is very different from a community hospital, which is very different from a
Right.
county hospital, which is very different from the academic medical center, the tertiary center.
Absolutely.
These are new geographies, they're new people that you're meeting, the patients that you're interacting with, and then of course the specialty that you're doing, pediatrics versus general surgery versus OBGYN. You're trying to get your comfort on, just the medical learning, let alone the social dynamics that are happening there. It's a very, I don't want to say traumatic, but I think all of us have many flashbulb memories of that time. So you're now in your fourth year, you're reaching the elusive MD initials after your name. What's the next step in the path of being a doctor? And for you specifically, what's next for you?
Sure. Yeah, so fourth year has been interesting. So I've done a cardiology sub-I, my medicine sub-I, and then I did a cardiothoracic surgery
Oh,
sub-I,
great.
as well. So, and what the difference as a fourth year, I think it becomes, you get a lot more responsibility, and I think for me, I found that to be more fulfilling and more enjoyable.
Sure.
And then again in fourth year, you get to decide. You sort of pick a specialty
Hmm.
when you're coming into fourth year, or at least you're narrowing down between two things. And so the content of what you're doing tends to be something that's more interesting to you, and more consistently, what you want to be learning and studying. So that's what I'd say about fourth year. What's next for me is now this question of where you're going to go to learn to actually be a doctor, where you're going to go to be a resident, and
Right. So typically, you're going through medical school, your preclinical years, then you're, quote unquote, on the wards for that third and fourth year. And then you're interviewing with programs, they're interviewing you. And then both sides are making a rank list of their top places to go for the applicant and their top applicants for the programs. And then this goes into a giant computer and an answer is spit out. And what's that date in April sometime you guys find out?
yeah, I think it's April or March. The match is so wild.
Yeah.
It's so funny. I had no conception of the match before I got into medical school. And I think if I had known about it, I would have been like, I cannot believe this many people
Yeah.
so far deep into their educations give up so much autonomy.
Right.
Because I think for most things in life, you apply to a bunch of places, you get offers, and you think about them, and maybe you negotiate between two places, and then you make a decision. Here, you put in a list, hospitals put in a list, and you get a letter, and you got
Mm-hmm.
to go.
Yep.
You got to go, or you forfeit your training. Um, and that is, that's a really serious thing. Um,
Yeah. And for many fourth year medical students, they're, making the decision between specialties like you said. So I mean the match can really be the point where they have to decide, I'm gonna pursue pediatrics or internal medicine or whatever surgical subspecialty. So that can be a very I guess gut wrenching slash soul searching type of experience. So for you, have you made that decision or what's the next step in terms of specialty for you?
yeah, absolutely. It was a hard decision for me. It was a very hard decision for me. I had gone through my clerkships, and I had loved everything. And it was interesting because I think you have this mix of things, which is that you're also paying attention to what group of residents and attendings you got along really well with, because I think that tells you something about yourself. And then you're also paying attention to what were the days that really really spoke. And then it's also, like you said, thinking about like, what are my values,
Mhm.
what's important to me in life, what's my relationship with the concept of family.
Mhm.
That was a hugely important thing for
Right.
me.
Absolutely.
Um, I kind of narrowed it in the end towards internal medicine and in general surgery,
Mhm.
and those were the two rotations that I was on, where I was like, okay, whatever the sort of fantasy in my head of what it meant to be a doctor, that's what this was. You know, that's where I felt like, okay, this feels like what I thought it was to be a doctor. And I think in both of those specialties, but it was where I was really experiencing, it's something, I think it's something very ancient and sacred when someone gives up their trust to you and puts their life in your hands. Um, uh, and that's where I was having those experiences. I felt most in touch with, okay, this is what medicine is. And so I enjoyed both of them, but I wasn't really sure which was the right one for me, and that's why I did those sub internships that I told
Yep.
you about, which is that
Yeah.
I stacked them early in my fourth year, not because I needed to, but because I wanted to get those experiences, a second look in the role of the acting intern, a little
Sure.
bit closer to what it would look like to be a resident in that specialty, and both, and see how it went. And I'll tell you, I love both clinically. I love the diagnostic reasoning in internal medicine. I really like, I like aggressive probabilistic thinking. My favorite attendings were the ones who, they didn't they knew of various diagnoses based off this presentation were at baseline, right? They knew the epidemiology, and then they also, when they went to do their history in their exam, they also knew the sensitivity of their various questions and how that changed the probability of the likelihood of those various diagnoses being right. And but I love both that aggressive intellectual thinking, and then
Mhm.
also the humanism that I think is really a part of internal medicine.
Mhm.
Uh,
Yeah, the
and then
master
in
clinicians, I mean, that's really the internal medicine doctors are, kind of like you're saying, they fill the role of what you imagine a doctor to be, the person who can step back and not just wax philosophical, but put the thought into action and a meaningful diagnostic and treatment plan, and it can be really powerful to observe in person, so I'm glad you had that experience. Tell me about how you made that delineation between internal medicine and surgery.
when I was thinking about surgery, I thought even for the smallest surgery, for the most routine thing, like I said before, if someone is trusting you
Mhm.
uh, to open their body, they're going under anesthesia. This is that what a what a kind of important and sacred thing. For me, in the end, having found a lot of joy and fulfillment in both of those roles, it came down to my interest in in policy and the social determinants of health,
Mhm.
and
Mhm.
really wanting to, I look at, I do some research in social determinants of health around health outcomes in housing and homelessness.
Mhm.
And I really looked at this and I said, I am not going to be happy if I continue to, in some ways, even at our county hospital, we're treating the symptoms of the ways our society um, is broken or was never designed
Mhm.
for everybody in the first place. And I said, I don't know if I'll be happy doing this at this level. I really want to try to work on changing those
Mhm.
things,
Mhm.
and both in terms of lots of things about the structure of internal medicine and hospital medicine, which is where I see myself headed,
Mhm.
were really more were really better fit for my interests and my career, and how serious my interest is
Mhm.
in policy. And so in the end, it became quite an easy decision for me,
Yeah. Mhm.
as someone who loved everything,
Yeah.
but saw the space and the place for me in internal medicine to go on and continue that work.
That's great. I think, I want to transition to kind of pros and cons that you've told other people who are pursuing medicine or coming to you for mentorship. And I think you hit on probably two of the most important pros for me. I think one is, you touch on in general surgery, but in any field of medicine, it really is, a unique and I think the word I don't know if the word is awesome, but it's an incredible privilege to be the role of physician for a patient. You have these experiences that, like you said, are really some of the most anxious and anxiety-provoking moments of a person's life, and you're filling the role of someone that can reassure them, help them, cure them, and that's something that really is very unique to medicine. And then the other thing that you mentioned is kind of your own diverse interests in whether it be administration or research or policy in particular. I think the MD degree certainly does not limit you in any way. So there are MDs who go on to have full research careers, full industry careers, full business administration careers, and the MD can really be a stepping stone to that. So, I mean, there are people within medical school that go there with the goal of not being a practicing clinician. They really want to, go on to do social policy work or work in government. And I think that's good. I mean, I think that's an okay thing. And so those are two of my pros, but I don't know if you have other major pros and cons that you tell people that come to you or ask you about.
Absolutely. I mean, I agree. I agree with those two, and I think it kind of comes back. We were talking about when you're deciding on residency, you're deciding on a career. These questions about, what is a good life, and what is going to make me happy. And
Hmm.
I see around me, especially I think in the Bay Area, I see a lot of people put massive amounts of energy into making money. Um, and I think if you're going to work hard, you're going to put a lot of energy into making people's lives better,
Yeah.
um, as alleviating suffering, uh, in some cases saving lives. I think, wow, what a privilege
Hmm.
that we have, that can be the way that we make our livelihoods.
Hmm.
That option of building a life that way
Hmm.
is was not open to my parents and my
Sure.
grandparents.
Yeah.
So I see this as like, what an incredible privilege that you could do that as your work. And I think too, even if you look at like, there's some work around the science of happiness.
Hmm.
Happiness comes from serving others.
Yeah.
It really, and so I think you talked about the cons, you know, in one of the problems with medicine is that there are some systems things in place that make doing that work
Mm.
of serving others, and the happiness of serving others, there are barriers to it. What an extraordinary privilege to serve others and to build quite a good life doing that.
Sure. And I think it's well said. The money in medicine, and I'll put some links with the podcast with, general salary trends for MDs. The short answer is that physicians, by and large, are essentially guaranteed a six-figure income. So it's never a matter of if you're going to have money to be comfortable and live well. It's a matter of, is for many people, I think the question becomes, are the lifestyle questions worth that? And if it's that question, I don't think, like you said, the money is not really the end all be all. There are much easier ways to make money than entering into medicine, finishing medical
Right.
school, and going through 3 to 7 years of very, very strenuous training afterwards to become a fully fledged certified doctor. So I've never encouraged anyone to go to medical school for a purely financial reason. It's nice to have a solid income, but I think the unique opportunity to serve patients is really the biggest pro by far. And those cons, I think, are exactly what you listed. There's the challenges that come with being a doctor and staying on call and going through many years of training. But many professionals work long and hard without that unique advantage of serving patients in the way that we're able to do. Something that I think is also a con that comes with it. And you mentioned, the happiness and the lifestyle, and there's an increasing focus on things like burnout for physicians because, the power to serve patients and being in that unique role as the caregiver and the provider, the healer for patients is very, very wonderful during times of good. It can be very, soul crushing during bad outcomes or feeling powerless when you can't help them in some way. And I think that'll be a nice transition for this last point that I want to ask you. So I think the current social and political health environment has kind of brought a microscope onto race and representation and kind of the intersection with health and medicine. And I think you've touched on that a little bit during our interview. This is kind of a broad statement, so I'm trying to lead you in, but I think you've underplayed it essentially. You've published in the New England Journal of Medicine, which is one of our most esteemed medical journals, about these topics of how race and representation really makes an impact on health outcomes. I really want to just give you the floor if you could comment on those items at large, because I do think it's important for individuals considering becoming a doctor, or even just listeners in general, to hear and maybe feel a little bit of discomfort, but also just breathe it in and kind of hear what's current and what's active in the medical environment.
Sure. And I agree with you. I think right now what's happening, especially because of COVID-19, is that people are seeing how much COVID-19 is basically a masterclass in social determinants of health for
Mhm.
everybody.
Yeah, yeah,
We're all seeing how much health outcomes are determined by these underlying factors, whether it's structural racism or it's your exposure to different aspects of the environment and climate change, or it's the legacy of housing policy and redlining, how these things, whether it's, would come into, and this has come away from the national conversation, but I will bet everything that it's going to come back very, very soon. This question about health insurance and who has access to
yeah,
pay for healthcare in the system that we have right
hmm
now.
yeah,
These politics and policy and national leadership are very much at the root of health in this country. And I think as doctors, we need to get more into that space to make change, or we're going to see another 100 years of things going on in the same ways, and the disparities that we care about continue in the same ways. So that's kind of become, I think, for me, um, the central interest and kind of driving force and philosophy behind my own work. And so I think that's sort of the direction that I'm going in, is to keep trying to not just understand the social determinants of health and how that's playing out in my patients' lives, but really go to the root of them and see, like, well, what decisions are we making as a society and as a people that lead to these health outcomes, and how can we start to fix them.
I think that's inspiring. I think that's a great note to leave off on. I think it's a serious note, but I think it's an important note for people, like I said, that are considering medicine, but also just, listeners in general. Derek, appreciate your time. It's really been a pleasure.
Chris, it was a huge pleasure for me. Thanks for having me on the podcast.
Thanks again for listening to the How Do I Become podcast. If you enjoyed this episode, please consider subscribing to hear future episodes. Also consider following us on social media and YouTube at How Do I Become One with the number 1.